Okay, so we're back with the last implant, and this is a very good learning implant. You notice that this site isn't as subgingival as the others, and so there is no submergence profile, maybe just a little bit on the palate here. The rest of it is pretty flat, so we've got to drape our crown to cover this tissue area, otherwise it's going to have a huge space in between the teeth, and it'll be a nightmare as far as food collecting. So you instruct the lab. So let me just show you what that looks like on the component itself. We'll take it off the model, and here's the molar. Now you might think of it and say, oh my gosh, that's just a huge area, but well, what we've done is we've actually contoured it so that it's going to be draped down into the tissue. Hopefully when he chews, the food will deflect off of that and not get caught up underneath. Now we've instructed Ned to floss and brush and certainly water picking, but we like this design. We feel that he can get underneath that and clean it and keep it clean. I guess the criticism is, oh, it looks like a giant overhang. Well, we've noticed that even in our temporaries that the tissue remains very, very comfortably clean, and the abutments are still functioning well. So let's go ahead and try this in the mouth. And here we go. And that's got his sunglasses on today. He's enjoying the. And we're going to go ahead and suction out that that abutment again. I might have gotten some moisture contamination, so we like to keep everything out of there. Any moisture contam, just get that out of there. Okay, threads are clean. We cleaned a little bit of tartar off the rim. Yeah, maybe a little more connective tissue here would have helped with this number 3 going in. So slowly I'll just put that in place. Now mind you, we haven't had to touch the other 2 implants. They just kind of dropped in, and I'll talk to you about the technique on how to obtain that. So there's minimal adjustments in the mouth. I'm gonna go ahead and just hand tighten this in. We'll just find out. There we go. So I'll try to show you that through the mirror. I'm just going to go ahead and hand tighten. There we go. So keep the implant in place, keep the crown in place, and the rest is the driver. And that's hand tightening. Now I'm also feeling my wrench with my hand to make sure that I don't feel tension on the screw. Now I'm going to slide floss through there, and I can hear it. See, it just snaps in nicely like that. And I'm going to snap it through the next one, and that snaps nicely. Now we haven't had to touch anything on these, and that one snaps in nice. So now, after I complete hand tightening, I'll go ahead and wrench that in, and then we'll fill these up. All 3 these orifices will be filled, and then we'll check Ned. Ned, just show everybody your bite. Just tap down gently. Just tap, 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 tap. How's your bite feel? Ned, perfect, huh? And we obtain that through a special technique that we utilize in another video on the bite registration, utilizing the peak abutments and shaping them so that we get a definite stop for the bite reg. A large edentulous area where you don't have teeth on one side and certainly minimal teeth on the other. This case could have been a real tough one to either A, adjust the occlusion, or B, not enough. So we're now tight. I'm going to finish the job now, and maybe we'll pick up again with you at the end of this segment. So I'm trying to give them to you in sequence. Dr. GERARD CUOMO with Ned on a platform switching implant case. Hope you're watching. See you next time.